Welcome back to MidPoint, and welcome back from Sierra Leone. He is the executive director for Fambul Tok. John Caulker joins us. John, before I get into another piece of news here, when last we spoke just a few moments ago, it almost sounded as if you were optimistic. It sounded like you felt a little bit better, that actually things were getting better, despite the fact that we see a growth in the number of people that have been infected by Ebola. Did I read you right? Is there some optimism there?
Yes. And the reason is because we are now involving rural women to this fight. In this fight, rural women have taken the lead to talk to household, door to door, to explain the importance of avoiding body contact, to make sure that, yes, when someone is sick, what to do. But the challenge is also, it's not just to say don't touch, but what to do. And also, they are producing soap to people to wash their hands regularly, to make sure that they avoid body contact. So it's more or less, the people are now taking the lead to complement the work of government and the international community. So that is what makes me feel very optimistic that it will be arrested shortly.
John, are the reports correct? We hear a lot of stories that basically what happens with the people there, that they are not very smart when it comes to the ways of Ebola. They don't really understand a lot of what it is, that it's modern medicine they don't get. We also hear that many times it stops because of ancient burial rites, and we've even heard voodoo that has been used perhaps by certain people in the outlying tribes. Is that part of the problem, or is that just overblown hype?
It is part of the problem, yes, but I think that has been put under control because as of a week ago, we now have about 98% safe burials. So sometimes we also need to go back to the drawing board to identify what is the problem. So the safe burial has been put under control with the support of the international community. However, the increase, there is still an increase in the cases. So I don't think that is the problem for now. I suspect the problem has to do with trust, encouraging people to come forward willingly to be tested. We should address this Ebola crisis with a human face, so people have confidence in the system. It's not just about coming to build treatment centers. Ebola goes beyond the health situation. It has to do with the community. It has to do with governance. It has to do with a lot of other ramifications.
And let me ask this then, John, because President Obama has asked for over $6 billion to help the fight against Ebola and the epidemic. With what you've just said then, is that $6 billion, is that money, is that going to help put that face on it, or is something else needed other than just money?
I think we need both. We need both. The financial support is good, but the challenge we have as a nation, as a sub-region, is how do we fight this Ebola virus in a way that we are able to lay the blocks for future capacity building in these communities, so that we don't have to go back to the international community at any time we have a crisis. We should be able to put in place structures in these communities for them to lead this process.
But that may take months and years, though, right?
Yes, but we need to start now, and that is why I would suggest the funds go. Because if it's just the medical people, yes, it's good. But how do we stop the transmission in communities? How do we reduce the the cases from going to the treatment center? How do we ensure that when patients are at the treatment center, they are able to communicate to their loved one? There is a huge gap in the community intervention, and that is what we are trying to do.
Let me do this, John. I only have about 30, 40 seconds left. We understand there's now a food crisis that's growing as well in the region?
Yes, it is, because people have not been able to continue with their farming. And these are all the issues we are trying to address with a new network that we've created called Bridging Communities Network. Because we believe this whole fight should not just be with the government. It has to be embedded in the community, so that people take their destiny in their hands. They need to be involved in this fight to eradicate Ebola in our country.
All right, John, I want to thank you very much for your comments again. It's a pleasure to talk to you. I hope you're still healthy and well, and everything in your group there is trying to stay as together as possible in some very difficult circumstances. We will check back with you again. Good luck, and thanks again.
Thank you for having me, and thank
All
you
right.
to everyone for listening.
All right, John Caulker in Sierra Leone. By the way, we should also point out that the latest news, one of the latest pieces of news, has a doctor in Sierra Leone that has been tested positive for Ebola. This is the 6th Sierra Leonean doctor to become infected in the outbreak. He is receiving treatment at this point, and again, the health workers there are under tremendous stress and tremendous possibilities of catching this disease so quickly, and they're now talking about over 100 new cases that were just reported on Sunday in one area of Sierra Leone. It is a fight we'll continue to cover. Other side of the break, the book that blew open the Benghazi investigation heading for the big screen. And at 34 minutes after the hour, former presidential hopeful and political analyst Alan Keyes weighs in on looming presidential actions.